Basically, osteopathic medicine is not really the new kid on the block. It's been around about 150 years. And it developed as a result of one man's frustration with the type of medicine or the lack of proper care or understanding of why we get sick back in the 19th century. And this was a Civil War surgeon out in the Midwest there by the name of Andrew Taylor Still. And he was a Civil War surgeon, and I joke about the fact that I think he got tired of amputating people all the time. But seriously, it was after the Civil War when there was a great opioid epidemic there. A lot of opium was introduced from the East, but then alcohol was rampant, laudanum, and later in the late 19th century, well, you had morphine in the 19th century. Late 19th century, you had heroin developed as a cure to morphine addiction. And Sigmund Freud was actually promoting that for quite a while.
Wow.
Cocaine. And Freud stopped doing that after a friend of his who was trying to treat with heroin for the morphine addiction. That doctor then committed suicide, and Freud turned his attentions elsewhere. But getting back to the osteopathic medicine basically is a complete form of medicine. It's really a philosophy based on 4 principles. And the principles include that the body is a unit. It's always communicating with itself. All the way from your left ear knows what your right great toe is doing at all times. The only thing is you don't really think about that because it doesn't affect your comfort or your survival. But like I tell patients, believe me, if you drop the concrete block on your great toe, you would all of a sudden communicate with your right great toe.
Pretty quickly, yes.
Yeah. The second thing is that the body wants to either compensate or heal itself, and it has the ability to do all these things. And I had one person say, well, what about amputation? Let's say you get your arm cut off, is it going to regenerate? Well, presently it won't, although there is research going on about that. But nevertheless, even the stump will heal. The wound will heal. The body has the inherent ability to either compensate or heal. And the thing that Dr. Still based a lot of his stuff on was that structure and function are inversely related. In other words, again, if you cut your leg off, you can't run the Boilermaker.
Right.
But if you do wear a prosthesis, you change the structure of that limb, you can then, you can be in Olympics.
So you mentioned you mentioned the cutting off of severing the arm at the elbow, let's say, and that your body actually regenerates and heals. So it's that concept that you utilize. It might be medicine, and it most likely will be depending on what your situation is. But also being able to put the body in a position where it can do the very same thing and heal itself.
Correct. Up to a point.
Right.
The body will compensate to a point, or it knows where to heal. So really, in osteopathy, all we're doing is we're providing the proper terrain, to use the phrase of Louis Pasteur, the famous guy who helped us with germ theory, which they didn't have until the end of the 19th century, is that you optimize the terrain so that the body is able to then compensate or heal. So those are really the basic principles of osteopathic medicine or approach. The last principle is that any rational treatment has to include those first 3 principles. Okay, the idea of the communication, the idea of a unit, the idea of structure and function. So people think, osteopathic medicine, that must be, where you take somebody by the neck and you crack their neck and stuff like that. No, that's not true. If anything, that would be like me saying, somebody say, well, what is an MD? What do they do? Well, they write prescriptions for penicillin.
Right.
Is that all they do? Yeah, that's all they do. Well, we know that's not true, okay? Osteopathic physicians, we're a complete form of medicine. In our local area, we have osteopathic physicians like myself, who was board certified in emergency medicine and practiced that for 30 years. We have a neurosurgeon in the area who's an osteopathic physician. We have a number of family practice physicians that are osteopathic physicians as well. So the business of manipulation, and by the way, most of us do not crack people's necks. It's a whole different, gentle way of doing things. But really, the approach is we use a lot of different things, whether it's medicine, surgery, whatever. I talk a lot about people's mental health, about sleep. If your sleep structure is off, that's going to affect your health. I talk a lot about eating and nutrition. If the structure of your eating, for example, you don't use a plate, knife, and fork, maybe you go to a trough like a pig, maybe we need to change the structure of where and how you eat, and so on and so forth.
Can you just, for instance, John in Mohawk, who came and said, it completely changed my life. How does that go? And by the way, for him, this happened in a very quick period of time. And within like a month, he was seeing a huge difference. Correct.
I know exactly who you're talking about, and John, a shout out to you. Thank you very much for those kind words. It doesn't always work that way. People who've had wear and tear as a result of, poor behaviors in terms of not exercising, not eating right, not getting sleep. I talk a lot about forgiveness, them not having good mental health. Over the years, this wears away at a person. So to get a person back the other way, sometimes it takes a while. I tell patients, you've had this for a while. Give me at least 3 times, about a week apart. Let me see if I can help you. And usually people will say things like, this is not working. I think I'll go elsewhere. And I respect that. But I have to say that most of the time, I do get either very quick results or a lot of times slow results that build on themselves. It's an additive thing. It's almost like going to the gym. If I went there, today and worked out once, I wouldn't look like Arnold Schwarzenegger. I'm not sure I want to.
Yeah.
Especially with the bonnet and goggles.
That's right, the bonnet. That bee in the bonnet. And next week we'll take another tackle at this, and I'll post all of this up on the website so people can get into it. And I just think that there are many people out there that are going down a certain road in treating whatever it is that their issue is, and a lot of people, chronic pain is a big problem. You see that being something that I just think a lot of people have that issue, and this is a different approach. If what you've been doing isn't working, you take a different approach. And you, as you've said, it's not one. It's not saying, all right, it's all going to be all medicine. It's going to be all exercise. Or it seems to be a combined approach, putting everything together to make it work and go forward.
Absolutely, and using anatomical and physiologic principles. So it's not just simply if you have a symptom, give a drug.
Right.
If I have 1 second there, a patient yesterday, one of many. Who finally he had his course of medication for hepatitis C, and we did our retest on him. He is completely cured of hepatitis C, which is one of the things we do. The other thing with chronic problems there, you're seeing the business of post-COVID syndrome.
Yeah, and we talked about that the other day.
60 days, 2 months after, having proven to have COVID, are still having problems, especially chest pain, shortness of breath, fatigue and headache and so forth. And we've treated people, and the osteopathic approach is one of many. I'm going to say that, but it's a thing that people should definitely consider as part of their treatment plan.